talking about oligoanalgesia, or pain, and in fact, the lack of pain medicine provided or the lack of pain control. And I was really pleased to see that you put 2 into this talk, because it really is an important concept. I mean, a lot of people come to the emergency department because they feel fine. No, a vast majority of patients come to the emergency department because they have some form of discomfort or pain. And we do a fairly poor job at addressing it. And because of that, it became the 5th vital sign. JCO in the United States in 2001 said that pain should be measured at triage and should be considered the 5th vital sign. So you have your heart rate, your respiratory rate, your blood pressure, and your temperature. But some people were like, a subjective thing as a vital sign? I mean, I can take a pulse. Mine's about 66. But, you know, somebody's pain control, somebody's pain, their own subjective feeling of pain, how are you going to objectively measure that? But JCO in the States says you have to measure this. This is a standard of care issue. So they came up with these pain scales, and it's like, yeah, I give it a 2 thumbs up, right? You know, how's your pain? That's what the triage nurse is going to ask you. And what do you think patients say on a pain scale from 0 to 10? Are they going, I don't know, 2? I don't know, maybe it's a 3. Do you think they're showing up and blowing off their afternoon because they have mild pain? No, what do people normally say? You know, 7, 8, 9, and you know, when I ask them, well, my pain goes to an 11. I just told you 10 was the maximum number. Yeah, I know, but my pain goes to 11. All right, so what are you going to do for pain options? Well, you have lots of options available to treat pain. You have analgesias, you have NSAIDs, you have ice, heat, splints, and where we found a lot of problems, opioids, right? Opioids, and it created a real challenge because of this graph. Look at that top line, opioid use to infinity and beyond, right? It really has gone up and up and up. And what's happened with that opioid use is, of course, the abuse. So the CDC says that 3 out of every 4 prescription drug overdoses is associated with opioid use. And it's contributing to almost 16,000 deaths a year. So it's a problem. But what that does is it puts a chill on things because people need their pain addressed. And there are groups, there are elements in our society who are at risk of oligoanalgesia. And these groups that are at risk include the elderly, women, people with mental problems, mental disabilities. They don't have their pain addressed in a timely fashion. The socially disadvantaged, the homeless, we need to be careful about them because they too feel pain. Certain minority groups are also at risk of oligoanalgesia.
Oh,
and then the final thing.
What about kids?
What about
you know what? I wouldn't be surprised if you suck, Milne, at managing pain in children. Quite honestly, I wouldn't be surprised if most of your audience sucks at pain control in kids. You know who the worst in the room is? As a pizza merch doc, I'd probably...
No, he's got to get something off his...
As a pizza merch doc, I'm actually probably the worst. How do I know this? There was a study in 2004 where they looked at pediatric patients presenting with fractures, and as it turns out, less than half were treated with pain medications. And the pediatric emerge docs did just as bad as the general emerge docs. So we all suck at managing pain in kids, as it turns out.
So I suck, you suck.
We all suck.
You suck.
And another study by Kircher in 2014 found that there was a delay of 2 hours in those kids that were managed with pediatric pain control or pediatric pain medications.
2 hours?
2 hours.
2 hours before they got anything.
How hard is it to actually identify pediatric pain? You use a Wong-Baker's face scale. It's really easy. You can have one in your pocket, on your phone. Triage can have it. It's really easy. There used to be some myths about pediatric pain that kids don't feel pain. Absolute crap. If you still believe that, it's probably time for retirement. You know, there's a number of ways that we can actually treat pediatric pain. Medication, You know, one of the things that people have used historically is codeine.
Yeah, codeine.
What a great drug for some kids. But as it turns out, it doesn't work for the kids that don't metabolize it. And the ones that are hypermetabolizers, well, you know what? They get respiratory distress, they get respiratory arrest, and they die. They die from your codeine that you gave them. Crappy drug. Wow, there's other options. I mean, intranasal fentanyl, oral morphine, ibuprofen, acetaminophen, using topical analgesia for kids that are getting LPs or IVs. There's a whole host of non-pharmacological things that we should be doing, things like distraction, music, playing videos in front of them while they're getting painful procedures, splinting. There's any number of things that we should be doing better for kids with pain in the emergency department. St. Augustine said it best, said that the worst evil is physical pain. My advice, we have to stop being doctors of pain. Thank you.
Well, I'd just like to introduce my colleague, Dr. Anthony Crocco. Let's give him a round here. Anthony's known to have rants. And so we call these RANThonies. And every year we get together at CAPE, we film one of his rants. And we've done fever fear. We've done cough syrups for kids and coughs. And now, with your help, we've done his pain rant. He also does this nice little new website called Sketchy EBM. So if you're always like, what is this EBM stuff? He's got this great website that explains the basic concepts of EBM. And we will be posting this rant on YouTube shortly. So to summarize, oligoanalgesia, it's a problem in the emergency department. There are people at risk, like children. There are lots of options available to us. Yeah, there is a problem of use and abuse when it comes to opioids, but that shouldn't prevent us from treating everyone with their pain. And so, like Anthony said, don't be Dr. Evil. Thank you very much.